Hello guys, welcome back to my channel. My name is Don Holy. As usual, I'm back again and I want to use this opportunity to shout out to Gloria Enim for requesting the video on midwifery. And there's so many other people. I'm a Kwedi Agnes, I've not forgotten about you, and many other people who are requested for it. So I'm here to create a video and I want to use this opportunity to thank all the returning subscribers. And if you are a new member to this channel, please subscribe to the channel, turn on post notification bell so get notified anytime I release a new video. Let's cut the conversation short and start the questions now. Now, if applied for midwifery, definitely should be expecting questions that are coming from the side of midwifery, either being higher than you or below you. Just expect anything and make sure you hit the call. So I'm here to present you with 10 questions. The first one that I think you are likely to ask that very day is, who is a midwife? Midwifery is a profession, and the person who is practicing that profession is called a midwife. Okay, so when they ask you who is a midwife, just go straight forward. A midwife is a health professional trained to support and care for women during pregnancy, labor, and birth. You can end it here or you can continue. They help you to stay healthy in pregnancy, and if no complication arises, to give birth with little intervention. Okay, so when your mother is pregnant, whoever is pregnant, and you go to the hospital, they go for postnatal, antenatal, and all that. It's just to make sure that the pregnant woman is in a good condition, and when it's time for pregnancy, you won't have much complications during the birth process. Alright, so the next question you're likely to meet is, what made you decide to become a midwife? This particular question is a bit tricky, but the interviewer is asking this question for some reasons. So the interviewer is asking this question in order to gauge what the candidate is like as a person and to understand why they want to become a midwife. Or the interviewer is just asking the question to understand why you want to become a midwife. So in the process of answering the question, the interviewer is looking for these key things: the drive to help others, then the true passion for midwifery, like the true passion for helping people to deliver safely without any complication, the resilience and abilities to handle difficult situations. Seeing someone die during birth is not an easy task. So you need to have that kind of true passion, the ability, the resilience to handle difficult situations. When the complications arrive in the world, you need to be able to handle it. So this is how to answer this particular question. My ambition to become a midwife started when I was young, or when I was a teenager, and spent a lot of time helping to care for my newborn nephew. Caring for him and my sister, who had postnatal depression, gave me the strength, self-confidence, and willingness to help others. So you could see that we are integrating all the things that I told you that the interviewer is looking for into my answer. So you can continue. When I could look after both of them successfully, whilst keeping a calm and positive attitude, I realized that midwifery was the right career for me. Simple, you end it there. You can give them this answer as well if you don't like the first one. I also think midwives are onto something in the way they support women. It's not the sometimes parental care of medicine. It's about making them feel supported and empowered to be mothers, not doing it for them. Okay, so you could have seen that we are integrating everything into our answers. So you can continue. I'm also quite tough and enjoy big challenge. I work best when I'm under little pressure and I want to get excited about something worthwhile rather than working in an office or doing something just to make money. Alright, so you could see that you are really giving them the main reason why you want to become a midwife. You are telling them that you want to support women, not for the money. Okay, so you are giving them a vivid explanation or a vivid answer as to why you want to become a midwife. So let's cut that one short and move on to the next question. So now the next question you are likely to meet is, tell me about yourself and why you want to become a midwife. After telling them what midwifery means, they want to know why you want to become a midwife, and you should tell them about yourself. So like I said in my previous videos, be precise. Now let's go. This is the answer I suggest you should provide. I am someone who takes my work seriously. I understand there is no room for error in respect of being a midwife in both the undertaking of your professional duties and also in respect of the advice you offer to women and family during their time under your care. you should know that pregnancy is something very risky. So if you offer a bad advice, the person will end up doing something which will cause the death of the newborn baby, of the infant or the unborn baby. You get it? So you need to be precise and give the thing to them. Bah, 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 and get your scores and leave. Let's move on. I am exceptionally hard worker. Always remain calm under pressure. Know how to communicate effectively to achieve the desired outcome. And will always uphold the values of your organization. The organization is MOH or the midwifery. Okay, so that's the profession, the organization. So you should be able to uphold their values. They have their norms and all. You should be able to uphold it. Now let's continue. I want to be a midwife, not just because of the challenges the role presents, but also in respect of the fact that I will get to have such a positive impact on people's life through the work I carry out. I am an extremely caring and compassionate person. I mentioned in my earlier video, before you undertake this particular profession, you need to be passionate. Passionate. You can see I'm mentioning it here. You can see yes, I'm mentioning it. So a key element you should include in your answer. Let's continue. But I am also someone who is resilient, confident in my abilities, and will always perform to be high standards necessary in my role as a midwife. Simple. So let's take a look at the next question. How would you approach a pregnant woman suffering from mental health issues? So if someone asks this question, ask this particular question, the panelists want to know how you can approach a sensitive situation in a case where the woman or the pregnant woman is mentally unstable. So when you meet this particular question, please try and integrate this particular key things into your answer. Knowledge of correct protocol. Knowledge of correct protocol means that, in every institution there are seniors. There are people who have been working there before you come. So they have more knowledge and more experience than you do. So when you cannot handle anything, you should be able to push it to someone who is higher than you to tackle that particular situation and solve it correctly. So you should have that knowledge of correct protocol. They want to hear this in your answer. Sensitivity and understanding. You should have that passion for patients. Not that the person is mentally unstable, so you should be shouting on the person and all that. It's not good. Then responsibility and proactive attitude. You should be able to accommodate any behavior of the patient. So now let's take a look at my answer. The answer I think you should be able to provide that very day to them that can blow their mind off. So the answer goes, firstly, I would speak to my supervisor and ensure that the patient is placed under the care of midwifery teams. That is, a midwifery team can be 2 or 3 people put together to take a look at or take a special look at a particular patient. Okay, so the answer continues. I will also request that someone from the team stays in regular contact with the patient and point in her direction of the correct mental health support. That is, if the things are trying to escalate, the person should be able to reach out to the correct department to handle the woman. Then the answer continues. It is important to be as supportive and the patient as possible in this situation. Like, you should be able to support the patient in this situation because the person is mentally unstable and anything that can happen, we'll be blamed for it. All right, so that's my answer to this particular question. Okay, so let's take a look at the next question. The next question that you are likely to meet is, how do you handle working under pressure in a stressful environment? The midwifery profession is not an easy task. It's not like RGN. Okay, midwifery is more tedious than RGN. That's why most often their salary is even higher than that of the RGN. So when you ask this particular question, the interviewer wants to see how you can manage the pressure that will be mounted on you. For example, if you are working in a cheap compound where you have about 3 pregnant women that are going to deliver the same thing, you are the only one with them. How do you handle the situation? This is what the interviewers want to see. So these are the key things that you need to include in your answer. Experience working under pressure. If you have ever worked at anywhere before, maybe after SHS you did some work or you open a business, and those pressures, you can integrate them into it. The ability to handle working under pressure, to manage yourself very well, no matter how high the pressure is on you, you should be able to manage everything. Then motivation and focus. In spite of all the pressures on you, need to be able to motivate yourself. Self-motivation is key, and should be able to have a focused mind and do your job. So after integrating these three things into your answer, I think you are good to go. But this is the answer I suggest you can give. I focus on the most important tasks at hand and getting the job done correctly. I have encountered many stressful situations during my work experience. I found out that staying focused on what is needed to be done and keeping a positive attitude help. Being under pressure stresses some people out, but it actually makes me motivated. Someone like me, yes. So you can see that everything out there, my answer, though is short and precise, but it includes everything that needs to be said during the process of answering the answer. The elements that the interviewers are looking for is included in this particular answer. So once you give it, trust me, you've hit the core and they can't deny you admission. Like I said, anyone watching my video, you have the ultimate. No need, no one is staying home. Just go and deliver as I promise. If you haven't watched the other videos I've released, come on, jump on it. The links will be in the description box. The links will be in the end screen as well. You jump and watch. Subscribe if you're a new member. Now let's continue. Alright, so the next question you can meet that day is, tell me about a time when you kept calm and focused during a stressful situation. I haven't answered the first question. They really want to know how you can handle difficult situations or stressful situations. So in this case, this is what the interviewer is looking for. First, asking this question tells the interviewer, or the interviewer wants to see the insight into how the candidate can behave when they are placed under difficult situations. So in answering it, these are some things that you need to include into your answer. A good example of working in a stressful situation. Okay, so if you have ever worked in a stressful situation before, integrate into your answer. If you have ever worked just any stressful situation that you've ever found yourself and you manage to comport yourself and do this thing, just give it an answer. So the second thing that should be also be included in the answer is the ability to stay calm and focused. It's part of the stress. You should have a focused mind and do what is right. Then the positive attitude. So these are the three things that should be included in your answer. So this is the answer I think you should provide. Since I'm talking about the health thing, I'm going to include a midwife in this particular example. So let's get to the answer. During my work experience, a patient was taken in for an emergency CS session following a diagnosis. I shadowed the midwifery during the entire time or the entire event and helped her with whatever she required, while keeping a calm and positive attitude for the benefit of the patient. Okay, so this one, I'm talking about being a midwife here. You are not a midwife yet, so maybe if you have ever worked in a cold store, you have ever worked in any shop before and you see someone who has been diagnosed of such a situation and the person has to be rushed to the hospital, it can be like, I shadowed my job, okay, or I asked permission quickly from my manager to take the person to the hospital and blah blah blah. You know what exactly you can do. Just find some sweet sugar coated words and give it to them, and then Charlie, move on, man, move on. All right, so now let's take a look at the next question. The next question that you can meet is, how do you react when you receive criticism? Some people don't take it kindly when you criticize them, okay, but criticism is actually a good thing. So the interviewers want to see the kind of feedback you give whenever you are being criticized, either in a job setting, in a house, or anywhere. The way you react towards that particular criticism matters. So these are the three elements you should be able to include in your answer: the ability to handle criticism, then the eagerness to learn and grow. The third thing, the strong listening skills. You need to have a listening ear as a human being. Not everything you think will be right. Some of the things will definitely be wrong. Someone needs to correct you. So you need to be able to pay attention, quick attention, rapid attention, listen and learn. Okay, so this is the answer I think you should provide. If you have any, can just miss them around. Not necessarily providing my own. So I give. Now let's go. I welcome criticism because it helped me build on my skills and find out what I can improve on. Okay, you can see that the answer is intertwining with the key element I've mentioned. If I receive criticism in a work setting, I thank the person for bringing it to my attention or my notice and listen fully to what I can do or what I have to do or what I have to say. Then I ask, what can I do differently? and try to implement the changes straight away. Simple. End it there. Do not do any long talking. When you say it's precise and it's on point, straightforward. So the next question you meet that very day during your interview is, what do you understand about the main duties and responsibilities of a midwife? This is the answer I suggest you should give. Though you can provide other answers, but I suggest, if possible, you can pick out some things in this particular answer I'm going to give to you and provide to them as your answer. So it goes like this. The main role of a midwife is to prepare women for the delivery of new life, and also to provide support and guidance during all stages of pregnancy, throughout the process of labor, and also during the early stage of postnatal stage. The duties and responsibilities I would have, that is, you are talking about yourself, you are referring to them about what you are coming to do if they give you the mandate to be trained as a midwife, would be to examine and monitor women during pregnancy, conduct screening tests, provide information and emotional support, undertake antenatal care, conduct assessment, maintain accurate record, and also to provide all level of support based on each individual's circumstances. You can end it here or you can continue. I would also be required to identify high-risk pregnancies and also demonstrate exceptional communication and interpersonal skills during emotionally charged situations. It's a role I believe I will excel in, and I fully understand the high level of responsibilities that comes with this position. So giving this particular answer contains everything. It's a mind-blowing answer that I trust me, if you're able to put out some of the key things that I've stated in this particular answer, no interviewer would reject you or will be like, this guy is talking too much. They are just giving the point and that's it. Let's move to the next question. I think I've given you enough questions. So I'll end it here. If you're new to this channel, please subscribe to the channel, turn on post notification must be the first person to get notification anytime I release a new video. And if you're an old member, thanks for coming back and for supporting us. If any of your friends want to apply to any of the universities, the forms have not ended yet. It's only necessary that their form has come to an end. So contact me, link me up with a person, and let me guide a person and let's do it. Let's do it. Colleagues that have done application for this year, I'm waiting for their testimony. I'm so happy when they are testing me, calling me. I've had my interview dates. I've had this. Oh, it's just awesome. It's just awesome. All right. So today we will end it here, and I'll see you in my next episode. Peace out.